Question 1. The graduate nurse, GN, is admitting a client for labor induction who is prescribed misoprostol for cervical ripening. Before misoprostol is administered, which of the following statements by the GN should be concerning to the supervising nurse? Select all that apply. 1. For oxytocin and misoprostol may be administered at the same time. 2. The client has had 2 prior cesarean births. 3. The client's cervical examination is 0 cm, 25% effaced, -3 station. 4. The client's contraction pattern is currently 6 contractions in 10 minutes. 5. The prescribed oral route if the administration is appropriate. Correct answer, 1, 2, 4. 1. For oxytocin and misoprostol may be administered at the same time. 2. The client has had 2 prior cesarean births. 4. The client's contraction pattern is currently 6 contractions in 10 minutes. Question 1 Explanation. Misoprostol, cytotec, a prostaglandin E1, is a cervical ripening agent. Cervical ripening is a process that normally occurs before the onset of labor in which the cervix softens and become more pliable so that dilation and effacement can occur more easily during contractions. Mechanical or pharmacologic cervical ripening methods stimulate this process and increase the client's probability of achieving a vaginal birth. In addition to ripening the cervix, prostaglandins, e.g., misoprostol, dinoprostone, can stimulate frequent contractions. Administration of misoprostol is contraindicated if the client is receiving another uterotonic simultaneously, e.g., oxytocin. The client has history of uterine surgery, e.g., cesarean birth due to an increased risk of uterine rupture at the surgical scar site. The client has an abnormal fetal heart rate pattern or uterine tachycytol, more than 5 contractions in 10 minutes. Question 2. The nurse is preparing to administer platelets. The nurse should 1. Check the abo compatibility. 2. Administer the platelets slowly. 3. Gently rotate the bag. 4. Use a whole blood tubing set. Correct answer, 3. Gently rotate the bag. Question 2 Explanation. The bag containing platelets needs to be gently rotated to prevent clumping. Abo compatibility is not a necessary requirement, but human leukocyte antigen, HLA, matching of lymphocytes may be completed to avoid development of anti-HLA antibodies when multiple platelet transfusions are necessary. Platelets should be administered as fast as can be tolerated by the client to avoid aggregation. Most institutions use tubing especially for platelets instead of tubing for blood and blood products. Question 3. The nurse is caring for a client with suspected Graves' disease. Which assessment finding requires priority intervention? 1. Agitation and confusion. 2. Heat intolerance. 3. Pulse of 110 per minute, irregular rhythm. 4. Red and bulging eyes. Correct answer, 1. Agitation and confusion. Question 3 Explanation. Thyroid storm is a serious and potentially life-threatening emergency for clients with Graves' disease. This condition occurs when the thyroid gland releases large amounts of thyroid hormone in response to stress, e.g. trauma, surgery, infection. Characteristic features include tachycardia, hypertension, cardiac arrhythmias, e.g. atrial fibrillation, and fever up to 104 to 106 F, 40 to 41 C. Other findings include severe nausea, vomiting, anxiety, altered mentation, and seizures. Question 4. The nurse assessing a client with an upper gastrointestinal, GI, bleed would expect the client's stool to have which appearance? 1. Black tarry. 2. Bright red bloody. 3. Light gray clay colored. 4. Small, dry, rocky hard masses. Correct answer, 1. Black tarry. Question 4 Explanation. The nurse would expect a client experiencing an upper GL bleed to have black tarry stools, melena. As blood passes through the gastrointestinal tract, digestion of the blood ensues, producing the black tarry appearance. Question 5. A client in the post-anesthesia care unit is being actively rewarmed with an external warming device. How often should the nurse monitor the client's body temperature? A. Every 5 minutes. B. Every 10 minutes. C. Every 15 minutes. D. Every 20 minutes. Correct answer, C. Every 15 minutes. Question 5 Explanation. In order to prevent burns, the nurse should assess the client's temperature every 15 minutes when using an external warming device. Question 6. A 1-week-old infant has surgery to repair a cleft lip. Which is the priority concern when the child returns from the recovery room? A. Feeding method. B. Maintaining airway. C. Preventing scarring of the lip. D. Preventing incisional infection. Correct answer, B. Maintaining airway. Question 6 Explanation. Immediately after surgery, the concern is airway. Because of surgery to the nares and the fact that newborns are obligate nasal breathers, swelling could occlude the nares. Feeding method will be a concern because sucking will interfere with the integrity of the suture line. Preventing scarring and infection are also concerns but not immediately on return to the floor. Question 7. The nurse is caring for a client with cervical cancer. The nurse notes that the radium implant has become dislodged. Which of the following actions should the nurse take first? 1. Grasp the implant with a sterile hemostat and carefully reinsert it into the client. 2. Wrap the implant in a blanket and place it behind a lead shield. 3. Ensure the implant is picked up with long-handled forceps and placed in a lead container. 4. Obtain a dosimeter reading on the client and report it to the physician. Correct answer, 3. Ensure the implant is picked up with long-handled forceps and placed in a lead container. Question 7 Explanation. The priority is to secure the implant to prevent unwanted and dangerous radiation exposure. The implant should be picked up with long-handled forceps and then placed in a lead container. This equipment should be kept in the room of any client receiving this therapy so that it is readily available. Institutional guidelines and procedures for managing dislodgement should be followed. Radiology is usually involved as soon as dislodgement occurs. Question 8. A client is being treated for injuries sustained in an automobile accident. The client has a central venous pressure, CVP, line in place. The nurse recognizes that CVP measurement reflects which of the following? 1. Cardiac output. 2. Pressure in the left ventricle. 3. Pressure in the right atrium. 4. Pressure in the pulmonary artery. Correct answer, 2. Pressure in the right atrium. Question 8 Explanation. Pressure in the right atrium is determined by blood volume, vascular tone, action of right side of heart. Question 9. The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. Correct answer, 2. Charting it separately on the output record. Question 9 Explanation. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it. Question 10. A patient has been stabbed in the neck and presents with an expanding neck hematoma. What is the next step in the management of this patient? 1. Orotracheal or nasotracheal intubation. 2. Emergency room open tracheostomy. 3. Percutaneous tracheostomy. 4. Stat angiogram and embolization and or stenting. Correct answer, 1. Orotracheal or nasotracheal intubation. Question 10 Explanation. In any trauma patient, the first goal is always airway control. One can use orotracheal or endotracheal intubation as a means of acquiring airway control. An expanding neck hematoma can easily compresses the airways, distort the anatomy, and lead to airway compromise. Endotracheal intubation should be done before this happens. Any type of neck surgery in the presence of an expanding hematoma can lead to exsanguination and distortion of the airway anatomy. Question 11. The client has returned to your unit after an escharotomy of the forearm. What is the priority nursing assessment? 1. Infection. 2. Incision. 3. Pain. 4. Tissue perfusion. Correct answer, 4. Tissue perfusion. Question 11 Explanation. Escharotomy is done for lack of circulation. So check circulation first. Pain is one indicator of adequate circulation. Question 12. The nurse should teach the client with erectile dysfunction, ED, to alter his lifestyle to 1. Avoid alcohol. 2. Follow a low-salt diet. 3. Decrease smoking. 4. Increase attempts at sexual intercourse. Correct answer: 1. Avoid alcohol. Question 12 explanation: avoidance of alcohol can improve the outcome of therapy. Alcohol and smoking can affect a man's ability to have and maintain an erection. The client should be encouraged to follow a healthy diet, but no specific diet is associated with improvement of sexual function. The client should cease smoking, not just decrease smoking. Increasing attempts at intercourse without treatment will not facilitate improvement. The client should be reassured that ED is a common problem and that help is available. Question 13. Which of the following principles is affected by a nurse's cultural or ethnic background? A. Veracity. B. Code of conduct. C. Ethics. D. Morals. Correct answer: D. Morals. Question 13 explanation: the term ethics refers to the decisions that a nurse makes during her practice. She often pulls from a variety of ethical theories to help shape those decisions. Morals are related to ethics but are also supported by the nurse's culture and ethnic background. The code of conduct outlines her responsibilities and the appropriate behavior within the organization. Veracity refers to the need for healthcare providers to always tell the truth when giving information to their patients. Question 14. The doctrines found in the Nursing Code of Ethics have all of the following attributes except they are not: A. Meant to guide a nurse's practice. B. Mandatory. C. Universal. D. Optional. Correct answer: D. Optional. Question 14 explanation: the Nursing Code of Ethics refers to principles that guide a nurse's decision-making and standards of practice. The standards in the code are universal, meaning that they should apply to every nurse, regardless of their location or type of nursing practice. Adherence to the Code of Ethics is not optional. Question 15. The right to self-determination refers to the A. Nurses' and physicians' rights to make the most appropriate decision regarding a patient's care. B. Physicians' right to make decisions about a patient's care if the patient is no longer able to make decisions. C. Patient's right to make decisions regarding care. D. Patient's right to choose a physician. Correct answer: C. Patient's right to make decisions regarding care. Question 15 explanation: the patient's right to self-determination describes the right that a patient has for decision-making during care. The patient has the ultimate responsibility for making his or her own decisions, regardless of whether the physician or nurse agrees. This may include completely withdrawing care or choosing a less popular option. The practitioner must be careful to avoid coercing the patient but must be sure that the patient has all of the information needed to make an informed decision. If a patient is unable to make his or her own decisions, he or she has the right to appoint someone, usually family or a close friend, to make those decisions.